On our Bronson Health Chat this week, as you've no doubt heard from time to time here on WKZO, you can see a doctor online using video visits at Bronson. Now, there are 4 kinds of these available. A Bronson MyChart video visit for current patients to see their providers. Bronson Connect video visit for immediate care for anyone in the community who needs it for minor health concerns. Bronson Connect video for counseling. And a Bronson Connect video visit for psychiatry for profile. Of Bronson's video visits, we have Denise Bartz, the Director of Practice Operations for Bronson Medical Group, with us on our Health Chat this week here on WKZO. Denise, good morning.
Good morning, Ken. It's great to be here.
All right. I appreciate your time this morning. So, Denise, what is a video visit?
Sure, Ken. A video visit is a way that you can connect face-to-face with your doctor or healthcare provider from your home, work, or really anywhere you have internet connection. You simply need a smartphone, a tablet, or a computer.
How do you make this work when you sit down in front of your laptop or your iPad or whatever you're using? How does this work?
Sure. A patient would access their video visit first by going to the Bronson website, or they would download a Bronson app to begin their visit. Once they connect, the patient answers some registration and medical questions, and then they're connected to the doctor online. Once the visit begins, the doctor will ask them questions, perform an exam, and offer treatment options, just like an in-person visit.
So these are, in fact, real doctor's appointments, Denise? You can really get the diagnosis and treatment without seeing the doctor in person?
Yes, they're real. The doctor-provider has the patient act as their virtual hands to check swollen glands, tender and sensitive areas on the body, and check their pulse. They can use the camera to look at the patient's eyes, their throat, etc. There are limitations. For example, we can't treat ear infections since they can't see inside the ear. If the doctor can't diagnose or treat the patient via video visit, they refer them back to the appropriate facility or just back to the office for an in-person visit.
Well, I mentioned there are different types of video visit options at Bronson. Can you tell us a little bit more about some of those options?
Sure. You gave a great description of our offerings. We have scheduled visits, immediate care visits, and a couple of behavioral health options. Bronson MyChart video visits allows patients to see their own primary care provider or a Bronson specialist. These video visits are scheduled by our Bronson practices, and I need to let you know, Ken, we've scheduled over 7,000 video visits since March. It really has been a great way for our doctors to stay connected to their patients during the COVID-19 pandemic. We also offer Bronson Connect immediate care video visits, and these are for anyone in the community who have minor health care concerns. No appointment is needed, and you can access the care day or night, 365 days a year. Due to COVID-19, Bronson is currently offering these visits at a discount rate of $20. A patient simply enters the code 2020 when they register for these visits. For our behavioral health, we offer Bronson Connect video visits for counseling, and these visits are for anyone in the community who wants to talk to a counselor about anxiety, depression, stress, if they have trouble sleeping. People can schedule these counseling appointments at their own convenience in the privacy of their own home. The Bronson psychiatry visits are very similar to our counseling visits, except these are done by psychiatrists, and psychiatrists are medical doctors that diagnose and treat psychiatric symptoms. Patients can also schedule these appointments in their own convenience, at their convenience too, in their home.
What if the video visits just aren't something a patient really wants to do, or they do have something that needs to be diagnosed or treated in person? Is it even safe to go to see a doctor or go to the hospital right now? Are you fully operational for patients?
Yeah, Ken, that's actually a really great question. We know that many people are being cautious right now, and they really should be. The safety of our patients, employees, and community is our number one priority. Bronson has taken all the necessary precautions. We do want our patients and community to know that it's safe for you to receive care here at Bronson. We have limited some of our services. However, we are now seeing patients throughout all of our locations, with the exception of Bronson Fast Care.
Well, Denise, where can someone go to get more information on this service?
Sure. If someone wants more information about Bronson, our video visits, or any of our services, I recommend they go to our website, bronsonhealth.com, or they're also welcome to call one of our Bronson Care Advisors at 341-7788.
Denise Bartz has been with us on our Bronson Health Chat this week on WKZO. Denise is Director of Practice Operations for Bronson Medical Group, talking about the Bronson Video Visits service. I will say I have had one of these. They work very well.
Oh, that's
and
great.
if you like more information, Denise gave you the sources to go to. Well, we thank you so much for joining us this morning. We appreciate the information, Denise.
Thank you so much. Have a great day.
You as well. On News Radio 590 and 106.9 FM, WKZO.